Thanks for tuning in. The moment a woman becomes a mother, she becomes a different person. Sometimes that change can be overwhelming. This word resonates with many women who have experienced a life-altering journey of motherhood. But what happens when the joy of motherhood gives way to darkness, anxiety, and feeling of inadequacy? Today we're talking about postpartum depression, a condition that affects countless women worldwide. So joining us today is Dr. Mary Udoh. She's a renowned expert in this field. Let's create a safe space to share stories, break the stigma, and find support. Dr. Mary, you're welcome to the show.
Thank you.
You're welcome, ma'am.
Thank you.
Okay, so this is one sensitive topic a whole lot of persons avoid talking about. But we have no choice, we have to talk about it because every day and day we hear different stories of what women go through the moment they become mothers. In fact, our guest shared a story with us last time of how a new mother had to kill her baby. She suffocated her baby and buried the baby. And so when it was evening time for people to come and bathe or visit the baby, they were looking for the baby and she knew nothing about the baby. She could not respond. And so they had to start looking around, only for them to see a shallow grave behind the house where she had buried the baby. And I hear this depression come in different ways. So if you could just take us through, if you have seen a woman who has this, you can just start with telling us the story.
Thank you very much for letting us delve into this very important but oftentimes relegated issue to the background. Oh, because so many people attach so many things to this particular issue.
Okay.
They'll point finger, oh, she's a witch, she's this, she's that, not knowing that she actually has healthcare needs and needs help. So when we talk about postpartum depression, it's not far away from us. That happen on daily basis, and we see women come down with this real time. So what is postpartum depression?
Okay.
Postpartum depression is a mood disorder that affects new mothers that recently gave birth. So it's a lot of changes that occur. Ideally, the birth of a new baby should be a joyous moment where the mother is happy, she's excited, the people around her are happy, the environment, the society. It's a thing of joy. But for some mothers, this brings serious sadness. So what causes postpartum depression? So there are lots of factors that come into play when we talk about postpartum depression. Pregnancy on its own is a very stressful condition for some women. Some may go about it very stress-free, like a normal process. But for some women, it could be very, very traumatic. It could be very, very depressing. It could be very, very demanding. So it's an interplay between hormonal factors, with the environmental factors and all those social factors and psychological factors, which come into play to make these changes marked or sometimes overwhelming for the woman. Okay. So for the hormonal factors, we have lots of hormones that come into play during pregnancy, from estrogen to progesterone to thyroid hormones. Many hormones are coming into play to make that pregnancy stand and take it to the end product that we look forward to, that bouncing, beautiful baby. So at delivery, these hormones are withdrawn, especially the estrogen and the progesterone that are withdrawn. And some of this can be so catastrophic for the mother. With these hormones being withdrawn, she can have imbalances in these hormones. Other factors too come into play, environmental factors. Sometimes there could be lots of interactions with who's supposed to give her that support, like the husband, the mother, the family members, the church members, the society, and she may not get that support. So this can tilt her towards other side. So having looked at what could be the possible things that interplay, maybe it could be an environment that, oh, she had a job, or on the course of the pregnancy, she lost her job, or her husband lost the job, and there's no more support in that family. So these are the things that come into play that can make the woman tilt towards the other side when it is actually the time for her to have so much joy. Then there could be other factors like, sense of guilt. Maybe she passed through a traumatic pregnancy, issues in the pregnancy. She may feel, I may not be able to take care of this baby. I'm not mother enough. And these things can make her to behave otherwise in issues that should give us so much joy.
All right, before Esther comes in, I wanted us to talk. Do you know what baby blues? I just hear that word, baby blues. So does it differ from postpartum depression?
Yeah, baby blues are just let me say, transient things that occur in new mothers.
Oh, okay.
Those ones do not stay long. But for postpartum depression, it can last for weeks, months, or even up to a year. But baby blues are transient things. The things are common, like it can be just, it happens once in a while. She becomes unhappy, then changes back and continues a normal life, takes care of her baby. But for postpartum depression, we'll really look at the symptoms of postpartum depression so we can really understand what it is all about. But it's different from those baby blues. Those are just transient things that do not really stay.
Okay. All right, Esther, you want to come?
I was going to ask about some symptoms of postpartum depression. Yes.
So the symptoms vary. Because two women do not have the same features. They don't have the same biology. So for some women, they can have very mild and few symptoms, but for others, it could be very overwhelming symptoms that begin like there's this feeling of sadness. I think that should bring joy. Every new mother glows. You just see, once the pains of labor comes, it's so painful, I can't bear it again. This baby comes forth. And as the baby comes, she smiles. And that joy, she will glow. But for this other mother, she becomes sad. She loses that attraction to an attachment to the baby. The baby does not concern her. She's not interested in that baby. And sometimes she goes into a vet crying. She cries. Nothing is happening. She just begins to cry and cries and cries. Sometimes she doesn't hold the baby. She doesn't suckle the baby. She doesn't touch the baby, doesn't bath the baby, and she feels so detached about the baby. Sometimes she has this overwhelming feeling of guilt. I may not be adequate. I may not be able to take care of this baby. I may not be mother enough to raise this baby or take care of this baby. So in some instances, she even neglects herself. She will not care for herself, may leave her hair undone, may not take her bath, may not even wash her clothes, does not even care about her own self. That's self-care. So she neglects herself, neglects her baby.
Those are signs of the
Yes, these are the features. Once you see this in a recent mother, in a new mother, don't just start shouting on her or casting aspersions or allegations on her. She has needs. She's sick. She needs help. She needs attention. And sometimes she may not even be interested in things that are happening in her environment. She's so withdrawn, doesn't talk to people, doesn't communicate, just stays on her own. In some instances, she may not sleep at all. And sometimes she may oversleep. She'll sleep and forget her baby. Because no mother sleeps and forgets her baby. My little brother's wife just delivered. And on that first night, I told her, I hope you've not laid on the baby. She said, no, Mom, I can't forget the baby. So I said, now you're a mother, a first-time mother. So take cognizance that you have a new person in your life now. So this mother may not recognize there's a baby in the house. She may not have time for that baby. And sometimes she may even neglect her own self, like she may stay all through the day and night without sleep. And sometimes she may sleep all through. Sometimes she may eat so much. And in some other instances, she may even refuse food. So when you see all those imbalances in a new mother, a recent mother, please, she needs help, she needs care, she needs attention. Not accuses or shouting or talking. It will further worsen the situation than change things.
All right, let's see. Have you seen a shift in the number of women coming down with PPD in the past,
recently, yes, lots of more mothers are coming on with postpartum depression recently. And this can be attributed to the changes that we observe in the environment now. Now, we have this upwardly mobile lifestyle that nobody cares about what happens to the next person. In those days when there is a new mother is coming forth, it concerns everybody. The husband is interested, the mother is interested, the mother-in-law is interested, the neighbors are interested. But now she may carry that burden alone, and it can be very, very overwhelming. And sometimes she may just be maybe close from work, and some work may not even give her that time, the time of that maternal leave for her to enjoy that quietness. She may be juggling around, how do I make ends meet? Problem, sometimes she may even have been the breadwinner in the family. And these things put so much pressure and stresses on her. And when she begins to calculate on how to make ends meet, or the accommodation is there, or there is no money for this, no money for that, probably need to pay fees, need to foot the bills, all those things can take a toll on her and make her to shift towards the other side. So those are the things we see now.
All right, before we go on a quick break, I would like to know, with all these things you've explained, how does it really affect the baby and the family entirely?
When the mother is not there to give that motherly touch to the baby is missing out. And number one, care of the baby, that bond, that connection. As the mother holds the baby close, it's a biology that is going on. There is a connection that's going on. That baby will be safe, secure with the mother. That bond is there. That's when she's lost, she can't do that. There is that division, there is that separation that cannot be gotten from any other person. Then aside from that, to feeding of the baby, the mother's breast milk is the best meal for the baby. So when she's not feeding, when she's not caring for the baby stands to lose a lot. Physically, the feeding, the meals, the bond of the mother, the care, physical care, birthing the baby, nurturing the baby, singing for the baby, talking to the baby, the baby misses out in all this.
All right. Esther?
Yeah, while you were speaking, I was trying to establish a link between postpartum depression and, say, the mental health.
Psychosis?
Yes. Of the mother before pregnancy. Could it be that postpartum depression is an offshoot of possibly someone who was suffering depression to some point, or this is like a trigger, or there may be some issues in the home front that also trigger postpartum depression?
Yes, like we're looking at one of the predisposing factors to postpartum depression is someone that had the tendency towards depression, that when these stresses of pregnancy come, the person tilts towards the other side. Also, family history of mental health disorders, maybe in other family members, then these are the predisposing factors too that could make her tilt towards the other side. Also, issues in the home when she doesn't have peace at home. Like I said, the husband, the spouse is not giving her the support, the family, other family members putting pressure on her rather than helping her, assisting her in this new status, rather putting pressure. Some mothers-in-law could be very, very petite. Maybe she delivers, the mother-in-law comes, instead of assisting her, she comes there to come and count the quantity of food, counts the quantity of meat.
Or maybe the gender of the baby wasn't what they wanted.
You've given birth to another girl. Okay, you want to do girls' factory here. So those issues that she doesn't have peace in that home could predispose her to postpartum depression.
Doctor, let's quickly take some few tweets before we bring our doctor back in. And we have our very first tweet here. It says, support after childbirth, considering the pain she's been through, drastic change to her body, a huge responsibility now placed on her, and the loneliness all built up, which leads to depression. With a strong support system, the woman feels more confident and comfortable knowing I guess the person missed out on some. And then the next tweet is, postpartum depression is real. As a new mom, the past 2 weeks, I have been dying inside. Oh, goodness. Anyway, stick around. We'll have some help on the way. And the next tweet says, if after childbirth you notice your wife rarely sleep or can't sleep at all, it's easily, okay, if she's easily irritated, rarely eats, she finds it difficult to bond with her baby, she behaves as if it is not even hers, she might be suffering from postpartum depression and she needs immediate care. Absolutely. And then the last tweet says, one of the causes of postpartum depression is lack of partnership. Wow, lack of partnership. Would you want to react to any of those tweets? That particular one, the lack of partnership.
Lack of partnership.
Both from the husband, the family,
yes.
Nobody's there to support her and all
partnership, support.
Support system.
Yes.
Yeah.
Like I said, no man is an island. It takes two to tango.
Absolutely.
That baby came forth when two people had a communion.
Yeah.
So that communion should continue. She needs the husband. She needs the spouse. She needs the mother. She needs the saints. She needs the neighbors. She needs people to support her.
Absolutely. I think this message should go especially to those men who, when their wife gives birth, that's when they remember to go on the tour. They take some leave and leave the woman, or some even go to another room and tell you this one now, the mother's business. They just stay away
I
from.
Sleep at night. The cry of the baby irritates me.
I hear some men say these things like, "Oh, my wife just gave birth. I need to travel. I need to go take some rest."
That's very wrong. That's very wrong. The mother having carried the pregnancy is a huge load. Then the stress of labor on its own, she needs that encouragement. She needs that support.
And you hear them say, "She the first or she the only?"
Oh no. She needs help. She needs support. Shows that reassurance. Oh, baby, you can do it. You can do it together. Can I hold the baby? Even when you can't hold the baby well, just being there, rub her on the back when she's breastfeeding. Say, "Oh, baby, you are doing very well. Oh, baby is so cute." Then just give her words of encouragement.
Absolutely.
"Oh, we brought this forth. See, the baby looks like you. Look at the mouth. Is your mouth. Look at the baby. Look at the fingers. Your fingers." So that shows that connection, that partnership. So it needs everybody to be part of what's happening. That new baby that's coming needs everybody's love.
Attention. All right, so now let's talk about the support, the treatment of postpartum depression. What are those treatments that are available for mothers? And how can mothers access this treatment?
The first thing that needs to be done is to identify that there is a problem, that there is a deviation from normal. So, and the healthcare worker will not come into your home to identify that mother that is deviating from normal. So it takes the partner, members of the family, the mother-in-law, the help, someone close inside that home that sees that she's doing things differently, that she's overtly angry, she's irritable, she's showing some things that were not supposed to be there. Then from there, you can draw attention that this woman needs help. So for that woman, she needs a psychotherapy. She needs to be taken to the hospital. And in the hospital, there are different ways of management. Sometimes she will need a therapist to talk to her and deviate her mind from what's already fixed there, like a kind of behavioral change. Then she can also have some situations where she needs to see a psychologist that will need to talk to her too. In some instances, it can get to a position that she needs medications. Antidepressants are there, and she can be given in the hospital. Please don't just go to the chemist shop or pharmacy and buy medications and take. You are endangering yourself. Once you notice deviation from normal, please take that woman to the hospital. She may not even know that there's a problem with her and she may not even want to follow you to the hospital. It gets into some instances where she actually goes out of the home, leaves her baby, goes out on the street like a mad woman. Yes, it happens. So that woman needs help. That woman needs care. That woman needs attention. The best place to take her to is to the hospital. Don't begin to take her to the prayer house or church or whatsoever. You'll be complicating issues. Take her to the hospital. She needs care. She needs help. Aside from receiving medications, the behavioral change, she can be linked to other women that pass through such situations and have experiences, and can share the experiences with her and also encourage her that you can go through, you can pull through. I passed through it. I had such situation when I had my baby, and now I'm fine. She can be linked to that support group. Then another help for that woman is the partner being supportive. Other members of the family being supportive. Whatever you can do to ease her, to make her rest better, to make her, you go there, help her, what can I do? Wash the baby's clothes, I arrange the room for you, cook for you. You can cook for a new mother, take the food to her, and take some fruits for her, some vegetables for her, let her eat and rest. And when you go, don't stay too long and gist. Allow her to rest.
Okay,
yes,
all right, that's important.
Her to rest. Yes, she needs that rest.
Okay, so
yeah. At what point should a new mother go for diagnosis? Because in Africa or in Nigeria, this part of the world, you find that this topic is rarely talked about, even during antenatals. I got to read this up myself. Because I love researching. When I had my first baby, I was just reading and I stumbled on it on the internet and I read in depth to know what that was. So for young mothers who do not have a clue about what this is, at what point do you think are there even facilities for such in our health institutions?
Of course, there are facilities for help and care. One funny thing about postpartum depression is the woman by herself may not know she's sick. She doesn't know that she's sick. In fact, when you start talking to her, she may laugh at you. She may laugh you to scorn. Just like someone out there that has mental health, like other mental health issues. There is that thing that she feels she's fine. So it is left for the people in her environment, in her community. Like you said, the spouse, the partner, the people living with her, the mother-in-law, the mother. Maybe you came to your daughter's home to assist her or to be with her when she puts to bed, and you notice these things. Then that's when you draw the attention of the husband or the spouse, say, this is not how she used to be. She needs help. So the woman by herself may not know that she's sick. Like a madman will tell you, you are the one that's mad, not me. Yes, there is no insight. She may not have the insight that she's sick. So it is left for the people around her to recognize these changes, then look for a way and take her to the hospital to seek care.
Why do you think, Dr. Udoh, why do you think there is still stigma surrounding postpartum depression? And how do you think we can break the stigma?
Well, anything about mental health disorder, there is so much stigma around it. And, some people will go about, instead of looking for help, say, that one, she used to turn mad when she's pregnant. That one, she used to turn mad when she's nursing her baby. We are talking about that woman. So there's so much stigma because people stop doing the correct thing and visualize the wrong things. And there is this closure that people tend to hide anything about mental health disorder. They hide it so secluded so that people will not know and carry it about. And with that, people fail to access care. Instead of taking the person to the proper place, they'll go to the wrong place so that people will not know. And in doing that, it endangers the life of that mother and that of the baby.
So how do we break this? How do we break this chain of stigma? You know, I know you're going to tell me creating awareness and all that.
Yes, that is what we are doing. Yes. So because some people do not know that this is wrong, that this is abnormal, and the person needs care. You know, people have this fixed mentality of when things happen, they attribute to something. Sometimes they can even tell the woman, confess. It's like you had an affair, you had extramarital affair, and now that you've delivered,
so you're guilty.
You are guilty. The guilt of that is now haunting you. Sometimes they'll say, oh, Ekpo Nkawo, it's making her to turn mad. You may not
seriously, I want to ask what that means. What does that mean?
Yeah, all of this.
That you went you went to someone else other than your husband. So it is the guilt of that is haunting you now. It is the masquerade, the ancestors that are pursuing you because you did this sacrilege. Begin to confess, and this woman that is already sick will begin to confess and say things that she doesn't know. And they said, didn't I tell you? Hey, she actually went out. I said it, and now she's confessing. And it's complicating issues. So these are the things around this postpartum depression. The people are attributed to so many wrong things, whereas that woman is sick and she needs help.
I don't know if this is attainable, if this is what happens in other climes, or is it just in Nigeria?
Oh, it's global. Not only in Nigeria, it's even worse out there, where actual diagnoses are made that are picked up early, because the caring for an expectant mother out there is different from the access that people have here. It's even the diagnosis is more out there in other climes that pay closer attention to that woman. So it's out there, and where mothers or expectant mothers pass through more stresses, the diagnoses are becoming more and more. More women are coming down with this, with more women carrying so much burden. You know, in those days, and the work of the woman was just to sit down there as a pregnant woman, sit down there, take care of yourself, eat, sleep, rest, no work, and take care of the home. But now, even with that pregnancy, getting to 10, some women actually go from work and go and deliver. Yes. They go from the office to go to the maternity ward and deliver.
I am one of them.
Really?
Yes.
Of course.
You see?
So I'm too one of them. I was attending to my patients, and labor came, and I had to go to the maternity to deliver.
Okay, so now let's deviate a little. Because what you guys just said now is something, it's just like a taboo. It's a crime. Because I know there is time for maternity leave. And when it's a few weeks to your EDD, your give delivery date, you are supposed to go on leave. But why is it that women do not like to go on leave? They work until they are EDD. Why?
I'll tell you why. Because I'm a doctor.
Okay.
That takes care of women. And see why. You know, most women want to have more time when they deliver.
For the baby.
Yes, to stay longer at home. So they'll struggle to keep working. Actually, you're supposed to go on maternity leave like 1 month before your EDD. So that you have the other 2 months or 3 months at home. But for even working mothers, they want to have all the 120 days after delivery, which is wrong. So, but actually there are still some other places of work that do not have such opportunities for the mother to go on the maternal leave, to go for that mat leave. So there's still some places of work that they don't have the liberty, but still other places have access to that. I want to encourage young women, please make very good use of that maternity leave that you are given. Take out some time before the delivery, go and rest. Wait for that baby. When the baby comes, use that other time to take care of.
I wanted to say if we can advocate for more time after delivery. But then I now remember this is Nigeria. Even if women are being given 3 months, they will still want 3 months after delivery.
Actually, they are advocating for 6 months maternity leave.
Okay, trust me when I say this is Nigeria. 6 months maternity leave, right? Some women will want to add that 1 month before maternity to make it 7. after delivery. They will still say in their workplace until the delivery day.
The actual time for maternity leave is fixed. The leave is fixed.
They twist this date.
Yes. So we're advocating for 6 months maternity leave and also paternity leave. With the father to
absolutely
take time from work to go on leave so that she can have more time to support her partner during that period.
Do men also have this postpartum? Because some men will tell you the pregnancy was me and my wife. We both were pregnant because of the kind of stress they go through during the pregnancy.
The men do not have postpartum depression because they don't have the hormones of pregnancy. But there's another form of depression they could have. A new baby comes with so much demands. Sometimes they need to change the accommodation. Sometimes they need to foot the bills. Maybe they were expecting a vaginal delivery and it happens to be a cesarean section for those that do not even access the free health services that are being rolled out in the state. And they have to pay expenses for a cesarean delivery that's expensive, and it affects the family income. And in some instances, the man may not be buoyant. And as these things are eating deep into the pocket, he goes into the other form of depression, but not postpartum depression.
Okay. Now, you made mention of something. I would like to know, your cesarean section and the vaginal delivery, does any of this predispose a woman to depression,
Well, postpartum depression, most times, we look at the hormones of pregnancy. But it depends on the features, the things that surround every delivery is unique. There are some women that have a smooth vaginal delivery. Go there, the labor comes, no stress at all. She puts to bed and go back. There are some that even have like a cesarean delivery that was like an elective. She goes in there, booked, just goes there to lie down and have the delivery. Then there's some that pass through very terrible labor, very traumatic labor, then finally ends up in a cesarean delivery. Those ones pass through a lot of stress, and those can tilt towards, those are candidates for postpartum depression. And also, some mothers have multiple deliveries. That's like mothers of multiples, like twins, triplets, quadruplets, and now that we're even having higher multiples.
Oh, really?
Yes, higher multiples.
How so?
Yes, higher multiples. Before you used to hear of just twins, maybe at most triplets, but now you see mothers come down with 4 at once, 5 at once.
And it's common now, it's more now.
It's more now because of this assisted delivery, that's assisted conception, IVF, yes. So those mothers can go into postpartum depression with delivery of these multiples to take care of 1, 2, 3, 4, 5 human beings at once and take care of yourself and demands on other family members. So with these things that are coming up in the environment, it's predisposing women to postpartum depression.
All right. I would like to know, apart from this advocacy we do on air, are there other ways we can create awareness about these things?
Yes.
So that women can know?
Yes, there are other ways we are creating awareness. Even like the Medical Women's Association of Nigeria, we don't only talk about cancer screening, breast cancer, cervical cancer. Every opportunity we have, we engage with the women. Like in churches, we talk to women. So we share ourselves into different groups. In your own church, talk to the women. Like in my own church, I'm a women's leader too. So every opportunity that I have when women gather, we bring out those things and discuss them. Talk to the women. Talk about, you are a Christian woman, the things that happen to you. Your body when you are delivering, the changes that occur in pregnancy, the things that you expect in after delivery, the things you can see. We engage the women, we engage the communities. So it's only when people have information that they can know how to handle these
such issues.
Yes, we talk to the women in opportunities that we have, every opportunity we have, we talk to the women.
All right, like when women come for antenatal, sorry, Esther, I have some question. When women come for antenatal, what do you tell them about the postpartum depression? Do you tell them okay, after delivery, you might experience this and this and this and kind of things. When you see these things, don't get disturbed. These are medical issues. Do you do those things? Because Esther rightly said, I'm sure she went to antenatal, but she didn't hear of any of this.
Yes, antenatal care is a whole package. Most of the teachings in antenatal care talk about how to care for yourself, how to care for your body. But, you know, this is like a medical condition now.
Okay.
A form of deviance from normal. Yes. But what is done in antenatal care is to teach you how to prevent this from occurring.
Okay.
Yes. So that's what's done during antenatal care. Like, you need rests. You need to eat fine. You need to eat fruits, vegetables, because when these things are not there, that is the thing that will predispose a woman to postpartum depression.
Okay.
And the things that will be seen, most times, it's not even the woman herself that will notice this, like I keep saying. It's the people around her. So they should be enlightened on these deviations from normal.
Okay.
But the woman there is taught self-love, self-care, how to care for yourself, how to take care of the newborn baby. Those are the things that are taught in antenatal care.
All right. Esther?
All right.
One
so
more.
does PPD...
Just a little question.
Okay, so I'm going to ask 2 questions
Okay.
in one. So does PPD pose any health risk at the long run to the mother?
Of course.
And how does...
It poses serious, like I said, it's a spectrum. That some women can have very mild symptoms. Others can go as much as committing suicide. Yeah, some can kill themselves. Some can kill the babies. Like the instance we looked at the beginning, saying she strangled the baby, killed the baby, and buried the baby. So those are very serious issues. She could kill herself. She could kill her spouse. She could harm any other person because she's sick. She's mentally unstable. She's sick. She can do lots of things. So those are the issues that may not concern that woman alone, can concern her baby, concern her family, her spouse, the society. Everybody is at risk around that woman.
And Nancy, please, just one more.
Oh, go ahead.
What role does the nutrition play? In alleviating the symptoms or helping a woman heal?
Like we said, during antenatal care, the mother is taught how to eat right. So when the woman eats right, when the woman takes care of her mental health, when the woman takes care of herself, she has less propensity to have postpartum depression than a woman that does not eat well during pregnancy, is exposed to so many things. So nutrition plays a whole lot. So we teach pregnant women, eat well, eat right. Balanced diet, correct nutrients, do lots of fruits and vegetables, and take enough rests.
All right, thank you so much. So as we wrap up today's conversation on postpartum depression, we want to leave you with a message of hope and support. To all the mothers out there struggling, know that you're not alone. Your feelings are valid and help is available. Let's break the silence, break the stigma, and create a supportive community for all mothers. Thanks to our incredible guest, Dr. Mary Udoh, for sharing her expertise and compassion. Remember, motherhood is a journey, and it is okay to ask for help. So until next time, from all of us here is bye-bye, and thanks for watching.